Hello, this is Professor Shaeer, Professor of Andrology at the Faculty of Medicine, Cairo University. And by andrology, we mean the science of treating male infertility, male sexual dysfunction, and abnormalities of the genital organs, such as penile curvature, such as premature ejaculation, such as sexual dysfunction of any sort. I have been doing this experience since 1995, and I happen, in addition to be a professor of andrology at the Faculty of Medicine, I'm also the professor of andrology at the European Academy of Andrology, and the holder of 2 PhD degrees in andrology, one from Cairo University and one from Amsterdam. And today I will talk to you about penile curvature. Penile curvature is the status when the erect penis is curved rather than straight. Curved in any direction, whether dorsal, upwards, whether lateral, sideways, or whether ventral, which is downwards. Now, this can be hindering to sexual intercourse. It may prevent intercourse altogether. It may make it painful to the female partner and may be aesthetically unappealing. And this can be corrected easily with surgery if required. And the cause of penile curvature can be either congenital, which is since birth, or since you ever recalled, or it can be acquired, which means that you have had a straight erect penis for some time, for years, and then something happened that rendered this straight penis curved. So congenital curvature and acquired curvature. Congenital curvature is a birth anomaly where the one surface of the penis outgrows the other surface, so leading to curvature downward, for example, or upwards. In any direction, there is overgrowth of one side over the other. It can be associated with hypospadias or epispadias, which is the urinary opening, the opening of the urethra from which one pees, is either down or up on the lower surface of the penis or the upper surface. So it can be associated with that or not associated, which is isolated congenital curvature without hypospadias, without epispadias, without any abnormality in the opening of the urethra. Now, the other type of curvature is the acquired curvature, and most commonly this is due to Peyronie's disease. Peyronie's disease is fibrosis of the penis, where the elastic tissues that expand normally will be rendered tough, firm, fibrosed. And this usually happens on one side and not the other, leading to curvature of the penis towards that side. Is there a medical treatment for penile curvature? The answer is maybe, in acquired cases only, when there is early Peyronie's disease. And by the way, let me tell you that there are also other causes of acquired curvature, such as trauma. So if someone is exposed to pressure, severe pressure on the erect penis, this may lead to fracture of the penis, and in this case it may heal by fibrosis. So is there a medical treatment? Maybe in early cases of Peyronie's disease, maybe there can be treatment to ameliorate the deterioration, to stop the deterioration, or even to correct the curvature in early cases without calcification. Calcification is deposition of calcium, such as like what happens with bones. So if there is, by ultrasound, if there is calcification inside the Peyronie's plaque, then medical treatment is not the first choice. If this is a late case of Peyronie's disease after years since it ever started, then this is too late for medical treatment. But generally, surgery is the only real solution if the degree of curvature necessitates surgical correction. Surgical correction is a one-day procedure. The patient leaves the hospital the same day, and it usually takes something between 30 minutes to 1 hour. So it's a minor procedure, but of course it's a delicate procedure and requires a lot of experience in this field. And basically the way we correct it is through a small incision, and we usually pull the penis upwards in the counter direction of the curvature. So if the curvature is downwards, we will pull the upper surface in this direction, in this way, such that we correct curvature. This is called the shortening technique. We shorten the longer side. This can be on the expense of length. If the curvature is mild to moderate, then the loss of length will not be an issue, really. The penis will stay in the normal length. within the normal range. But if the curvature is very severe, then we need to perform an alternative procedure that will not affect length. And in this case, we have two options. The first option is my own technique, corporal rotation technique, Shaeer's corporal rotation technique, which I invented in the year 2006. And ever since it was invented, it was republished and published and republished again from me and from other colleagues around the world who have reproduced this technique successfully and have had excellent results with it. Therefore, there are a lot of publications now on Shaeer's technique, and you can see them in the description. So this rotation technique has a very smart geometric principle. In the penis, we have two rods. These two natural rods or cylinders are called the corpora cavernosa, and they are curved in case of a, for example, downward curvature. So what we do is that we rotate those cylinders this way, so they become straight without shortening. So rather than, instead of pulling them backwards, we rotate them in this way, so the penis becomes straight without any loss in length, or maybe a very minimal loss in length in the experience of some surgeons, but not in my experience. This is Shaeer's corporal rotation technique. It is devised for congenital curvatures, the ones that have been since birth, and mainly ventral downward curvatures, severe ones, not sideways curvatures, and not acquired curvatures with Peyronie's disease. The other technique that will not involve a lot of shortening is removal of the Peyronie's plaque. If we have a tough fibrous tissue plaque, like a little stone, we can remove it and we can put a graft instead. But this has the downside of a possibility of erectile dysfunction. So yes, we can do it, but the patient has to know that there is a possibility that he may require medical treatment for erectile dysfunction in 30% of cases. And sometimes it might end up with surgery for sexual dysfunction, for erectile dysfunction, which is the penile implant surgery. And you can go to my other video about the penile implant surgery. It's a beautiful surgery that gives a man the possibility to perform sexual intercourse every day, several times a day, for life in most cases. So yes, of course, if penile curvature is associated with severe erectile dysfunction, severe impotence, in this case we will perform surgical correction for curvature along with penile implant surgery in the same setting. So this is an overview about penile curvature. I will make more videos to talk about more details of this issue. And how do you evaluate yourself? On my website, you will find a link with a self-test, online self-test. You will be presented or greeted with several pictures for several types and degrees of curvature. If you click on what you experience personally, you will be taken into a series of pages that will explain your situation, whether or not it requires correction, and what the preferred technique is. Alternatively, you can send me an email. You will find it in the description. You can also book a meeting, online meeting, Zoom meeting, where we discuss your case. Also the link in the description. And I welcome you to my hospital in Egypt, Kamal Shaeer Hospital, which is a center of excellence in penile surgery, worldwide known. And like we said, most surgeries are one-day surgeries. Please let me know if you, in the comments, if you have any questions. I will be happy to answer them by comments, via email, via online consultation. And see you soon.